welcome everybody. Wonderful to see you all here this morning at Professional Day.
This year's theme, Influence for Change, signals how we as nurses, midwives and carers are at the forefront of change in health. Our professions are constantly evolving, and now more than ever, that evolution demands innovation.
You are a mighty union. Your historical record of leading social change and industrial change in this country is extraordinary.
I think Van Batten has always something interesting to say, and I think we need to be very cautious of the disinformation, misinformation.
Everybody, left, right, centrist, indifferent, politically confused, agnostic, can be targeted by disinformation.
She's a really good author, so it was very inspiring to see her.
You look at all our social media and there is so much disinformation in that space.
Sharing things that you don't agree with is actually help perpetuate the information that has been initiated.
Do you think that patients and family members often experience disrespect in the healthcare system?
There should be a mutual respect to each other, both ways.
Our mindset is one way of disrespecting our actions and our body language as well. That taught me to be a bit mindful of how I care with my patients.
Oh, the midwifery panel today was fantastic.
We're going to talk about the future of midwifery, where we see that going, and how we as midwives and nurses can influence for change.
We've got really intelligent young people wanting to do midwifery, but we just can't hang on to them.
There's lots of things you can't do because you're at the mercy of the overarching obstetric model of care that you're working under.
We need to do something and we need aid and assistance from the government to do so.
The simple things that we are asking the government will save us.
I will put the woman's wants, needs, cultural needs on the table, say what can we do, what can we make happen.
So we need to think outside the square. Midwives and I would say nurse practitioners need to be employed within the primary healthcare space, not just within the acute healthcare hospital setting.
We are the largest group of health professionals. Imagine the impact we can have if we all ended our silence and said this isn't right.
I'm always encouraging the midwives to use all the different bins and things, but it does seem a little bit wasteful when you don't feel like you're supported by the system to make some of those changes.
So let's influence better end-of-life care for trauma survivors. Let's be curious, let's lean in, be present and gently ask, what happened to you?
It was fantastic. The speakers were really inspiring. Loved it.
Brilliant. I love Professional Day. It was the best day ever.
One of the most brutal form of gender-based violence. That's what FGM is. And a brutal form of discrimination and an attack on autonomy, sexual rights, and so much more.
Very motivating and uplifting.
Oh my God. What a brave and honourable woman she is.
But we stop it, we protect, and we circle back if need be. That's my position.
Really enjoyed it. Powerful speakers and really learnt a lot.
This is my first time. It's actually been a really good eye-opener and it's actually invigorated us to actually do more for our branch.
It sort of empowers us when you go back to our branches, and it helps us to become better members and better clinicians when you go back.
The members want you to know how unheard they feel.
It's been a long 12 months and we voted this government in thinking that they would actually listen to us, and they haven't. So we've had to actually work harder than we've had against the Liberal government because we're working against a government we thought would be working with us, and they're not. Your truth-telling, it's essential and necessary for us to hear that. We're not going to grow and improve as a government without that honest feedback and collaboration.
Will you also ensure that all nurses, midwives and carers in New South Wales are eligible for essential worker housing as recommended by the Upper House Inquiry?
They are under review and we will ensure that they capture all of those essential workers that you have described.
I think it's important that the Minister actually hears real stories of what's happened and what's happening within the service currently.
And I was impressed that they listened and that they already reviewed some of our questions. I don't know that they actually got how devalued nurses are really feeling.
We understand it is an interim offer. We understand very, very clearly that we need to increase your wages. We understand very, very clearly that the work that the Independent Industrial Relations Commission is doing, particularly from my perspective around the gender pay gap, is absolutely critical. Today I've decided that in New South Wales we need to move towards establishing a Chief Midwife Officer in New South Wales Health.
It's finally happening. I do have great hopes for it.
we do need that midwifery-specific representation.
Very exciting for midwives today to hear that announcement, and we just have to hope that the right person gets the job and really fights hard for midwives and for women and babies.
Minister, will you commit to recommencing the review of the workforce planning tool Birthrate Plus?
I can commit to that today, and also can commit to this, that the issue of midwifery and birthing services across New South Wales, in particular in regional, rural and remote areas, has to improve.
Nurses are exhausted, we're stretched beyond safe limits, and unless something changes, we won't just walk away, we will run.
We need to also start to get ready to build what will be the next component of ratios going forward. We've got a long way to go, but I can assure you, while ever I'm your health minister, the workforce will remain my absolute top priority.
Just see if they keep their promises. They're politicians, so they're not renowned for promise keeping, but we'll see that and hope for the best.
We will be holding them to account, and we've put timeframes in place. We're not sending them away to do whatever they want. We're going to be in partnership with them, and that's a really big important thing.
Again, we get treated as numbers in our state's smallest hospitals and in every hospital across the state. Expected to clean toilets, expected to deal with crises, and when we talk to management about that, they say, well, we won't staff to a crisis. Every day in our health system is a crisis, and it's good to hear you recognise that.
Never ever forget what has been achieved.
Delegates, you are the heart of our association, each and every one of you. With your stories and your strength, you are standing up for our members and leading the charge to win improvements in facilities.
Our work together not only improves the lives of our members, it improves the health and aged care systems here, nationally and internationally.
We're committed to improving our professions and building a stronger, fairer and more sustainable health system. One that provides better job control, where gender equality exists and where governments and employers respect and value the work you do. Let's continue to move forward with passion and determination to a future committed to winning for our members and for our professions and for the generations of nurses, midwives and carers to come.